let them in. So hi everyone, thank you so much for joining. I'm Beth and I am the Deputy Director of Endosupport United. Emily is our incredible creative director. Tonight we're joined by some of Endometriosis South Coast's amazing team, who the lovely Jodie is going to introduce in just a second. This evening we're going to be talking about endometriosis and mental health in quite a few different aspects. So we're going to get straight into it, and just to quickly let everyone know, this webinar is being recorded. So I'll pass over to Jodie.
Hiya, so I'm Jodie from Endo South Coast. We have Crystal, who's our trustee, and Sadie, who is a fellow endo warrior, and we've done some research together. So I will just crack on with it, I think. So I shall share my screen when it pops up. Can you see my screen? No? Good old technology. There we go. So, again, I'm Jodie from Endo South Coast, and I'm going to be talking about endometriosis and stress. So I conducted a study for my master's degree last year, once my mouse decides to work. Oh, now it's gone too far. There we go. And it was all about perceived stress levels with women with endo. I interviewed 907 women from around the world. They filled in a survey for me, and it's clear, and as we expected, stress levels in women with endo were significantly higher. But we didn't just ask for a questionnaire to be filled out. We had a small sample of endo patients that took part in an interview with myself. There were a lot of themes that emerged from the questioning, and I've put a few quotes on the slides, but obviously I haven't got enough time to go through all of them. We identified feelings of distress when talking to friends and family and not having the education that was needed to clearly describe what endo is and what it does to the body, as well as distress over them not wanting to learn about endo. Feelings of not being listened to ultimately led to a negative impact on specific areas of their lives. Not being listened to by health professionals had a great impact. Psychological comorbidity was a strong theme that emerged from these interviews, with many women expressing feelings of their mental health being negatively impacted by endometriosis. Feelings of shame in some form, whether it was because of feeling pain, not understanding something, or because of the impact the disease had on personal lives, was a recurrent theme, which then impacts self-esteem and finances, that can then go on to cause patients to miss out on different achievements and life events. Chronic pain as a disability impacted on personal lives and caused losses there, including many patients losing partners and friends. Social aspects that includes pressure from loved ones due to having to cancel plans because of the inability to leave the house has the potential to lead to social isolation and can massively affect the way endo patients view themselves and their lives. There's a lot of normalisation of pain and symptoms due to sexual bias in medicine, with many patients feeling that due to the many roles they carry as a woman, their pain is not real and exaggerated in some way. Many women believe that they just have to live their lives the way they are due to endometriosis being viewed as just a bad period. Many patients that were interviewed found it hard to correlate the symptoms of endometriosis, treatments, and the physicality of the disease. For example, endometriosis can cause extreme bloating that can make the patient look heavily pregnant. However, it can also cause infertility. This can cause huge amounts of emotional pain to a patient if it's openly identified by someone asking when they're due. Many patients suffer with feelings of loss of their female identity due to the treatment options or infertility, which in turn cause conflict in relationships with others and giving some patients a distorted view of themselves. There are feelings of guilt surrounding hurting the people that they love due to not being able to meet expectations. This is especially true surrounding children, as reported by myself in a different study. A study by Benoit in 2011 showed that out of 1,026 patients that were interviewed, many reported that daily activities were negatively affected by endometriosis symptoms. Results show that half of the participants reported problems with their sex life. 47% of those made appointments with their GP for painful sex, and 36% of participants reported that endometriosis affected their relationships and family. 17% even reported their type and colour of clothes being affected by endometriosis. Another study in 2018 by Van Aken tested the cortisol levels in the hair of patients with endo and compared it to that of healthy samples of the same age. They found that in the endo sample group, cortisol levels were statistically higher than those of the healthy sample. This is important because the effects that cortisol has on the body that can lead to chronic stress. We've seen through the slides that endo patients are struggling more and more in many aspects of life. These aspects individually or as a whole can have confounding impact on the relationship with their children and family. Many patients with endometriosis become dependent on healthcare providers and family members due to symptoms of both the disease and side effects of treatments. This may leave patients with endometriosis with negative feelings of being a burden on family members and that they are having to care for them. All of this is especially difficult for the children of women with endo. As can be seen in the diagram, parental stress and child health both impact each other. There are mediators that can impact both factors, which may lead to a vicious cycle of anxious and depressive behaviour of parents, as well as anxious and socially isolated behaviour of the child. Female children of patients with endometriosis may also be impacted mentally by thoughts that they themselves may be diagnosed with the disease. These feelings have the potential to lead to poor health-related quality of life due to poor diagnostics, despite the prevalence of endometriosis being 25 to 38% in female adolescents, not forgetting the psychosocial impact on schoolwork and socialising with peers. In a study by Markey in 2017, it was shown that both physical pain and psychological stress negatively impact the health-related quality of a patient with endo. This supports the theory that higher levels of pain are associated with lower quality of life. As can be seen in the diagram, reduced mood has been shown to alter experienced pain by greater neurocircuitry activation. This is linked to changes in emotion regulation that have been induced by pain. This is where the sickness cycle kicks in, and there is a constant cycle of pain influencing stress that then influences pain. When there is a shift from acute to chronic pain due to the self-sustaining and worsening properties in endo, there is an adaptation that occurs in the brain. This is caused by dopamine not being transmitted effectively, which manifests as an inability to feel pleasure in things that you used to and diminish motivation. In an attempt to regain balance, there is a between-system adaptation that occurs. This causes surges of stress-related hormones to be released. These changes cause the brain to perceive incoming pain signals differently and can cause the way it is felt to be over-exaggerated and predict higher levels that would actually be felt. These things then feed back to the beginning and the cycle starts over and over again. This results in changes in brain structure, including a loss of grey matter in those with chronic pelvic pain, and leaves patients in a chronic pain state. Because of these changes, patients with endo and chronic pain can present with clinical psychopathological symptoms that are similar in nature to those that are found in drug addiction patients. Thank you for listening to me go on about this. I chose to highlight this so that when a doctor next tells you it's all in your head, you can reply with, yes, some of it is from a neurological point of view. So how are you going to help me? And that was me.
Thank you so much, Jodie. That was brilliant. So I'm now going to be talking about medical trauma. So what medical trauma is trauma which is experienced as a result of medical procedures or illnesses, hospital stays, etc. So this can cause lasting effects, including clinically significant reactions such as depression, anxiety, post-traumatic stress disorder, complicated grief, and somatic complaints. And it's not just the living with scary and debilitating symptoms which can lead to illness-induced PTSD. Encounters with the medical system, from invalidating doctors to invasive tests, surgeries, and other procedures, can also be traumatizing. El-Gabalawi says that illness-induced PTSD is not currently well recognized. However, a recent body of growing literature on the topic has increased this limited awareness. So while there is, as with most things to do with endometriosis, still a long way to go, progress is slowly but surely being made. So that's why we're doing this webinar, is because we really want to push the importance of course, endometriosis in general, but especially the impact it can have on mental health. And I'm talking about specifically in regards to trauma, because it's something that is really neglected in general. So some ways in which medical trauma is different from the types of trauma we usually hear about from the Mighty, which is a website or app I would really recommend, where people from the chronic illness and disability community share their thoughts and their stories. And I really like it. It's a great website and app where you can read content, you can engage if you want, you don't have to. So the first thing is that chronic illness doesn't have a fixed endpoint. So this can be really hard for a person to come to accept, because we don't know if or when we're going to feel better. We know that as of right now, there is no cure for endometriosis. So both of these pieces of information, or lack thereof, can significantly affect someone's mental health. Something I personally find helpful is reminding myself that while we don't have a cure right now, and there is a long way to go, as I said, in many aspects of understanding endometriosis, science is ever evolving. So one day we could find a cure and better ways to manage and treat the condition. And something I wish I'd been told when I was first diagnosed with endometriosis is the fact that it doesn't have a cure right now. But as will be touched on later in the webinar, we're often diagnosed and then kind of sent on our way without much information, which can definitely also affect mental health and come into play with trauma. The second thing is that illnesses are internal, not external. So this means that some of us can find it difficult to feel comfortable and safe in our own skin. With the types of trauma we usually hear more about, triggers can sometimes be avoided, but for a lot of us with endometriosis, our triggers that we have due to trauma we've experienced within medicine lie within our own health, or our own bodies, or hospital appointments, etc., which are all things we can't necessarily avoid. Another thing is that sometimes we're supposed to be on high alert, which can of course increase anxiety levels in someone who's experienced trauma, because we're often told by doctors to monitor our symptoms and our responses to medication and so on, which is of course really important. However, this does mean that we don't always have the same opportunities to kind of step back, switch off from these things, because unfortunately that's not how endometriosis works. You don't get a day off from it. For a lot of us, it is an every day, day in, day out, every night thing. And the final thing is worries about the future. Of course, this is something that affects absolutely everyone to some extent. However, for people with endometriosis, there's kind of an extra layer, is how I think of it. So a lot of us might feel frightened.
Beth, I don't know if you can hear me, but we've lost your audio.
Do we want to move straight on to Sadie?
Yeah, can someone swap with her? Her Wi-Fi's gone. She'll be back in a sec.
Yeah. Sadie, you're up.
Oh, it would help if I turn my audio and my video on, wouldn't it? Oh, this is going to go well. Sorry. Okay, let's start this. Can you all see my slideshow?
Yeah.
Yeah, fabulous. Okay, hello, and thank you for listening to me. My name is Sadie. I'm a psychotherapist working in the adult mental health team in Portsmouth. And as I said earlier, I work very closely with Jodie. She's been an absolutely fabulous patient representative for us during this study. But also she's been a really wonderful support for me personally, as I was diagnosed with endometriosis in 2016, so a while ago now. And I want to talk to you today about a study that we conducted in response to my own personal experiences as a result of diagnosis and getting diagnosed with regards to one of the things that really shocked me in a way was the lack of provision of psychological support when women are diagnosed with endo, purely because, you know, it's a huge life-changing situation. It's a big adjustment, and also kind of learning how to manage and accept and live alongside these symptoms. So very pleased to work alongside Jodie and my fabulous colleague Tom. So Tom also took part, and I believe he is somewhere here at the moment. So hello, Tom. So what I was interested in looking at is trying to think about how often are women offered psychological therapies as part of this journey. And what we know about endometriosis is that on average 1.5 million women in the UK have a diagnosis, and it takes on average 7.5 years to be officially diagnosed. So that's a lot of time going back and forth to the doctors to try and be heard. As Jodie spoke about earlier, it's not just about the physical condition. We know that it has a significant impact on our social and sexual and interpersonal relationships. And in terms of the cost that this has to the UK economy, £8.2 billion a year is spent with regards to treatment, loss of work and healthcare costs. We know that there's currently no cure, and the main objectives typically with treatment presented within the NICE 2019 guidelines are about pain control, looking at how to improve women's quality of life, how to look at preventing disease reoccurring, fertility preservation, and reducing any damage. The thing that I'm interested in exploring was that we know that women who suffer endo, they tend to report very high levels of anxiety, depression, and other psychiatric disorders. And we also know on the flip side that high levels of anxiety and depression can amplify how we experience pain. But even though that we know there's a huge psychological impact, there's currently no recommendations regarding how psychological services or psychological therapies might fit in for patients' treatment plans. So my aim was to look at, is there a need to offer patients with symptoms of endo psychological therapies as part of their treatment? And also to see if there was a way in which we could establish a direct referral pathway between the gynae team at the QA Hospital, which is our local hospital in Portsmouth, and our long-term conditions service, which is within the Talking Change IAP service. We recruited patients using the Endometriosis South Coast Facebook group, and they were invited to complete a survey of 9 questions. Questions generally were very open. I was curious to find out about when they last struggled emotionally or psychologically because of their symptoms, the impact that this had. So that doesn't just have to be about relationships, that might be in terms of work, social, general functioning. Have they ever been offered psychological therapies or support during their journey? And also, have they experienced thoughts of ending their life or self-harm as a result of their physical health symptoms? All respondents had either a diagnosis of endo or undiagnosed symptoms of endo. And in total, we had 35 respondents who were aged 17 to 52. Obviously, with regards to well-being of risk, in terms of our risk policy in line with our service, all patients who reported suicidal ideation or self-harm behaviours were encouraged to speak with their GP. So rather worryingly, 92% of our sample reported that they'd never ever been offered psychological therapies during their investigation and treatment for endometriosis, despite there being a high record in terms of people presenting with anxiety and depression disorders. 60% of our sample reported that they had had thoughts of ending their life, or they had taken action to end their life or self-harm from the onset of their physical symptoms due to struggling with their symptoms and mental health. 64% of our respondents reported they struggled emotionally or psychologically due to their symptoms daily. So if you think about the numbers that I'm talking about right now, over half of our population reported they'd felt suicidal or had self-harmed in response to their physical health, and they're struggling every single day, and yet there's still not that provision of psychological therapies. These are some of the areas that our sample reported on in terms of impact on functioning. So to kind of reiterate what Jodie's already said, as you can see, it's not just about physical well-being. You know, they've missed work, they've missed family events, they have insecurities in their relationships. They might present as being less affectionate through fears of having intimacy and subsequently pain management or pain as a consequence. There might be feelings of guilt, feelings that, you know, I'm not doing good enough, I should be doing more, I'm letting others down, feeling irritable, angry. Also the kind of the impact of pain medication as well. It's very much a dilemma in that pain medication will make you feel better, but then it impacts on your ability to function. Cancelling social plans, avoiding previously enjoyed activities. You can see again, we've got a lot of psychological presentations, so stress, anxiety, low mood, struggling to fit into normal clothes due to bloating, which is my favourite one that I do, and also avoiding going out due to fears of pain. So our conclusions from this were that, you know, as I said, the vast majority of our sample have not been offered or signposted to psychological therapies as part of their treatment, despite evidence that this would be helpful. There's a significant impact not only in their mental health, social functioning, but also interpersonal relationships. And 60% of our sample experienced suicidal ideation as a result of their endo. So there, I guess to summarise effectively, incorporating psychological therapies as part of the treatment plan for patients would be beneficial to support them, not only to kind of develop skills and tools to manage their mental health problems, but to also find ways to live alongside their symptoms of endo. With regards to suicidal ideation or self-harm, these are some of the absolutely amazing support services that are out there. Papyrus is particularly for younger persons, and you can text SHOUT, which is a crisis line, 85258. That doesn't matter if you're younger or an adult at any point. You can also contact Samaritans, Mind. Staying Alive is an absolutely fabulous app if you're having suicidal thoughts, and it also contains things such as safety plans, well-being plans, and also you can talk to your GP. Currently, the Improving Access to Psychological Therapy services offer treatment for people with long-term health conditions. One of the pathways that they do currently offer is chronic pain. Although endo is not specifically a pathway within this, often they can assess you for endo and they can signpost appropriately to chronic pain services if necessary. So with regards to some of the techniques that you could use to just help ground, one of them is 54321. So if you just do this briefly with me now, it's thinking about 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, give yourself a good smell, and 1 thing that you can taste. And the purpose of doing this is to try and help you come back to the here and now. And often when we have suicidal thoughts or very overwhelming feelings, it can be very easy to kind of time travel along with those or lose sight of the present. So we're trying to come back to the here and now and ground. Smell is another really effective grounding technique in that it's very closely linked with memory. So positive smells can help to bypass our threat system. I'm sure you've all walked past someone and smelt their perfume and it's made you think of someone from your past. And it's that kind of impact, it's that link, it's that association. So we can very cleverly manipulate our brains into responding positively if needs be when feeling anxious or low. A self-soothe box is another fabulous companion if you find yourself feeling low, and typically I would encourage our patients to kind of spend time creating this self-soothe box prior to having a kind of difficult time, because it's very difficult to think rationally when we're feeling heightened in our emotions. So it's trying to make a little shoebox up of stuff that's soothing for you prior to the event itself. And this can contain some lovely photos, a playlist of lovely music, any positive affirmations or quotes that you've shared with friends, or any activities that you find soothing. So I put crochet down there, but I personally find that very distressing because it drives me mad because I always lose my stitches, but depends what vibe you're feeling with that. Tip skills is another one. So this is something that we use to manage the stress tolerance. So changing your temperature. So if you're feeling very emotionally heightened or overwhelmed, it can be really helpful just to put your hands in cold water, put a cold flannel on your face. Doing intense exercise, so this could be star jumps, running around on the spot, running up and down the stairs, and that's going to help you use up some of that adrenaline and anxiety that might be in your body. Paced breathing, which is something that lovely Crystal's going to talk to you about shortly. And paired muscle relaxation. So that's where we really squeeze our muscles as tight as possible and then just let all that tension go. And lastly, it can be really helpful to develop a traffic light system with those that you're close to. Because what we're trying to do sometimes is, if we are struggling, it can be really difficult to tell people to reach out. And one of the things that we know, especially with hopelessness, is that can tend to predict suicidal thoughts or attempts. So even if it is just texting a friend or a family member a green circle, an orange circle or a red circle, just to give them a sense of where you are and managing your feelings and your symptoms, then it's about making that plan when you're well to let them know what that means to you and what they could do differently in order to support you. But it's just about trying to start that conversation, not saying this is what I need, this is what I want from you, but letting them know that you're struggling and that you need them to be there. Thank you very much for listening. I hope all your wombs look fabulously jazzy like this one, and I'll pass you on to the next presenter.
Thank you for that, Sadie. Before I start, Beth is back, so she's just going to finish up.
Hi everyone, thank you so much. I'm so sorry. That's what happens when you have Virgin Media, apparently. It just stops working, but we're back, so it's all good. So as I was saying, the final thing of many things, of course, but the final thing that I'm listing today that separates medical trauma from the trauma we hear about more generally is worries about the future. So of course, that's something that affects everyone to an extent. But the way I think of it is that it affects people with endometriosis kind of with an extra layer, because a lot of us feel quite frightened about the fact that, as I mentioned before, endometriosis currently doesn't have a cure. So we don't really know as much as we would like to about what the future holds in that respect. And then there's also worries of what problems could we run into in the future because of our condition. I know a lot of people my age worry about, is this going to affect my fertility, and so on. So yes, those are some of the things that separate medical trauma from the trauma we hear about more generally. Of course, that's not to say one is better or worse than the other. That's just some of the ways that they are different. So next, Daniela Paolone, who is a mighty contributor and a therapist who provides therapy for those with chronic pain, illness and trauma, told The Mighty she recommends working with a chronic illness-informed therapist who can provide support, understanding and coping tools to help you manage your chronic illness, PTSD or both, or trauma, anything really that is affecting you because of your chronic illness or pain. She'll often use mind-body approaches, relaxation, and encourage self-care to calm your body's stress responses. So mind-body approaches and finding a therapist who is informed to do with chronic illness, I believe, is something Sadie touched on, and Crystal will be touching on mind-body approaches, and Emily will also be touching on counselling. Daniela Paolone also recommends self-care activities that promote body movement, which I well know for all of us isn't always a possibility, but where it is, it can be really beneficial. Attending therapy regularly, again, not always possible because it's nowhere near as accessible as it needs to be. But if you have the opportunity to do so, it can again be really helpful. Considering medication if and when it's needed, utilising a support network of loved ones if you have that, if not, online support groups, etc., can still be really helpful, and also engaging in activities that promote expression like drawing, journaling, etc. Now, as has been mentioned, it's all in your head is something that the majority of people living with a chronic condition like endometriosis will unfortunately have heard many times before, whether that's from doctors, family, friends, or just people that barely even know us or our situation. Being told by anyone, especially by a medical professional, that the symptoms you are experiencing aren't real can be a really, really distressing experience that massively can contribute towards medical trauma. It can leave patients doubting their own reality or even questioning their sanity due to gaslighting, or losing faith in the medical system altogether and resulting in them thinking, I'm not going to go to the hospital because they don't believe me, they're not going to help me, which can of course lead to further problems down the line. The psychotherapist Britt Frank on Instagram says that trauma interrupts our ability to feel at home in our bodies. Trauma healing helps us feel safer inside our skin. Physical illness makes it difficult, if not impossible, to feel safe inside the body, since inside the body is where the threat lives. Not feeling safe inside the body during an illness can be a major trigger for trauma or PTSD. She also discusses how invasive medical procedures can actually be mistaken by the brain for attacks. So when we're given anaesthesia, our bodies become immobilised, and while we're not awake or able to recall most operations afterwards, our bodies are still registering what's happening. So of course, not everyone who has a procedure is going to experience trauma or PTSD, but it is very possible, so it should be acknowledged. Logically, we are aware that the procedures we undergo are necessary, but the limbic system, which is a set of structures in the brain which deals with emotions and memory, isn't always logical. Therefore, it can misinterpret the nature of a procedure and, like I said, misinterpret it for an attack. So if you have a procedure or diagnosis and you start to notice things like nightmares, anxiety, depression, and so on, just know that you're not alone in that, and there is help out there for this, and it's really something that we're trying to push for there to be more support available for, because it does affect a lot of people. And it's also really important to note that a procedure does not have to be life-threatening, or any situation doesn't have to be life-threatening. It could be an injury, a test, anything. For it to be traumatic, it doesn't have to be a life or death situation. PTSD is about the brain's interpretation, not the external situation. So some of the things that can cause medical trauma, just some of them, are an invasive surgery, receiving a diagnosis, recovering from an illness or an injury, gynecological procedures, going to the emergency department, being gaslit by a doctor, being on bed rest, difficult pregnancies, or childbirth. Now, something I wish that I was told and that people in general were told is that you can say no to a procedure, first of all, which I'll get onto in a second, but also that things like general anaesthetic can really play with your emotions. I wish I knew that that was somewhat to be expected and that that was normal, and there wasn't something wrong with me in particular, that the first time I had general anaesthetic, my emotions were all over the place for quite a significant amount of time afterwards. So again, if you do experience that, please don't hesitate to ask for help. I know it's a lot easier said than done, but it is important, and you're not the only one who is experiencing it. So something I personally have noticed about the trauma that we experience as chronically ill people with endometriosis is that sometimes we do end up in situations where we have to experience something which we found traumatic to us more than once. Maybe this is because it was a procedure which we now need to have repeated in order to help our physical symptoms, despite the fact that it could be quite detrimental to our mental health. Of course, this can be a really distressing experience. And for a lot of people, it's actually been exacerbated by the pandemic that we're currently facing, because people are often having to attend their appointments and procedures and so on alone rather than having somebody with them. So they're missing out on that usual support of a family member or friend that they might be used to, or that they just might have felt more comfortable with. And as I touched on before, I do think it's really important that people are told you can say no to an examination or a procedure or anything if emotionally you're not okay with it, or physically, of course. But if you've experienced trauma with something and you're being asked to put yourself in a position that is going to cause you a lot of stress, you're allowed to express that and ask what your options are, or say, no, I'm not comfortable with this today, if that is what you feel like you need to do, and you should never be pressured into doing anything you're not comfortable with. So to conclude, as much as I am slightly biased, Teens with Endo Facebook group, which is run by Endo Support United, which is where I started off as a member, has really, really helped me in dealing with everything being diagnosed with endometriosis has kind of brought into my life and continued with, but also in dealing with some things that were quite traumatic that I've experienced within hospitals and things, because being able to talk about it privately in a safe environment online with people who understand and where it's all confidential, it is just something I would really recommend. It's been really, really beneficial to me. So yeah, that concludes my section on medical trauma. Thank you all so much for listening. I know it's a bit of a heavy going subject, but it's definitely not spoken about enough. So we really want to help drive forward that change and make sure it is something that's spoken about and that people can get the help they deserve when they've experienced it. So thank you so much again. I'm going to pass back over to Emily now, and massive apologies for the technical difficulties earlier on.
Thank you, Beth. I'd just like to start by introducing myself. My name is Emily, and I'm speaking today on behalf of Endo Support United. I am 19 and I was diagnosed with endometriosis when I was 16. I'm going to be covering the mental health implications of endo in adolescence. As I'm sure you're all aware, endometriosis is a gynecological disease that affects 10% of women of a reproductive age. The average woman's reproductive years are between 12 and 51. This means that adolescents aged 10 to 19, although often overlooked and discredited, do suffer from this disease too. Research done by Souris et al. In 1996, and I do apologise if I've just said that wrong, found that when compared with controls, a significantly greater proportion of adolescent females with chronic illnesses, such as endometriosis amongst others, reported emotional problems and mental illnesses. Unfortunately, due to there being a lack of research in this area and in adolescent endometriosis in general, actual statistics are unknown, though it goes without saying that quality of life can drastically suffer. Since this is known, my question is, why is psychological support not offered upon diagnosis? My personal experience with diagnosis is that I received a letter stating that I had endometriosis, and that was pretty much it. I didn't get to see my specialist for a good few months after that and was left to dwell on things, and the impact on my mental health during that time was awful. Endometriosis can have a negative impact. Endometriosis can have a negative impact on all aspects of life, from education and work to self-esteem and intimate relationships. As someone whose symptoms started at a young age, I've been told plenty of times over the years that I'm too young to have endo, and I really struggled to find a doctor that believed me and wanted to help. I wholeheartedly believe that had I not been lucky enough to have a mum that also has endometriosis and a fiery, no-nonsense personality, I still wouldn't be diagnosed. I've had doctors tell me that I'm being a drama queen, an attention seeker, and that it's all in my head. And it's all too common for young girls to be victims of medical gaslighting, and the knock-on effect on their mental health can be devastating. Personally, and I know a lot of fellow sufferers can relate, I downplay and ignore my symptoms because I'm worried that I'm going to be called a liar or a hypochondriac. I'm aware that this can be very dangerous, But this mindset and way of thinking just goes to show how damaging even one person saying those things can be. As I previously touched on, I know that I am very lucky to have such an amazing mum who really understands and fiercely fought my corner when I was younger. However, it is unfortunately common for young girls to not have that support system during those influential years. A lot of young girls grow up being told that they're looking for attention, are doing it to get out of school, are being dramatic, and that their symptoms aren't real. This can understandably be incredibly frustrating and hurtful. It can lead to feelings of self-doubt, embarrassment, and resentment, which can further delay an already long-winded diagnosis process, and in turn can cause even more physical and mental damage. It won't come as a shock to hear that having a chronic illness can be isolating at any point in someone's life, and even more so during adolescent years. When I was at school, none of my friends could relate to what I was going through. I regularly had to have time off school, so spent a lot of time that normal teenagers might use to socialise playing catch-up. I was constantly anxious that my education would suffer, so I put way too much pressure on myself to make sure that that didn't happen, unfortunately to the point of making myself even more ill. I missed out on so many fun experiences because I was in pain or I was bleeding too heavily to join in, and even though I understood why I was missing out, I did still feel excluded and lonely. Groups such as Teens with Endo, which is run by Endo Support United, became a place where I knew I could be understood and not judged. I've got a huge support network of people my own age that truly get what I'm going through. It's lovely to be involved and to sit back and watch amazing friendships blossoming. We did an anonymous voluntary survey within our Teens with Endo Facebook group to find out how having suspected or confirmed endometriosis has affected the participants' mental health. One participant said that they felt very alone with no one to turn until they found the group, as they felt that people were bored of hearing them talk about how they were feeling. Another, who is still awaiting diagnosis, said that the tests and invasive procedures she's had to endure feel endless and pointless, so she's now scared of doctors and hospitals, and in turn worries that she'll never get a diagnosis. She's been left questioning whether her symptoms are real and feels like an imposter, which only ups the anxiety she feels. We found that a very common answer was that teenagers are very worried about the detriment endometriosis could have on their fertility and intimate relationships. It can often be the case that it's hard to tell how your fertility has been affected until you're actually trying to conceive. So many sufferers feel robbed of the opportunity to properly plan for the future and prepare themselves. The fear of the unknown is absolutely terrifying. For some people, having children is something that they've always wanted from a very young age, so they can be left feeling robbed of this. Your teenage years are those when you start experimenting sexually and getting into relationships. A few participants said that they were either physically unable to have sexual interactions or worried that they wouldn't be able to. Worrying how potential partners may react and perceive them was also common, and caused some to hold back or even end relationships. As you can tell from these answers, this condition has a significant impact on a teenager's mental health, sometimes to such a severe extent that they are left feeling that they have no reason to live and the only answer is suicide. A study conducted by Endometriosis UK found that 25% of women with endometriosis have contemplated suicide. This might be a shocking statistic for some, but as part of the endo community, you sadly hear of it all too often. Nancy Pearson, an endometriosis advocate and RN, very aptly said, "Endometriosis is not fatal, but despair can be." Endo Support United are lucky to have their very own in-house qualified child and adolescent counsellor who specialises in CBT. Kerry also suffers from endometriosis herself, so truly understands and is incredibly helpful. I personally did CBT counselling around the time when I was first diagnosed, and I can't even put into words how life-changing it was for me. It helped me come to terms with the very turbulent time in my life and accept my new diagnosis. It gave me skills that I still use a few years on when things get rough. I honestly couldn't recommend reaching out to a counsellor enough if you feel like you may benefit or are in need. I'd just like to end my section by saying I hope that what I've said has shed more light on how mental health of adolescents with endometriosis can be affected. Thank you for listening. I'll now hand you over to the lovely Crystal, who'll be discussing the benefits of holistic practices on endo.
Thank you so much, Emily. So I'll just start sharing my slides I've got here. Okay, so I'll start by introducing myself. I'm Crystal Izzet. I'm a yoga teacher. I'm also one of the trustees for Endometriosis South Coast. I started my yoga practice as a way to deal with mental health issues. I'd had what I could only describe as an emotional breakdown. I felt absolute rock bottom. I was isolated, hopeless, and knew I had to do something. So I found a yoga class close to my home and just showed up, never having done a class. I actually signed up for an Iyengar yoga class, which is a pretty intense alignment focused practice. But 2 sweaty hours later, I realised that I'd been completely focused on my body and the postures. And although my body was absolutely exhausted, my mind was so clear. No anxieties, no self-hate, no hopelessness. It was like a reset button had been hit. So needless to say, I was really curious as to why it had that effect on me. I became an avid student and 5 years later started my yoga teacher training so that I could share this powerful practice with other people. So the main focus of this yoga talk is the mind-body connection and how we can improve mental health by connecting to the body. So it's kind of a bottom-up approach. So just a quick explanation of what yoga is, because I think very often we have preconceived ideas about it. I have 2 photos here from my yoga practice. So the top photo is what we see on a lot of platforms like Instagram. So these pretzel-like shapes, and this definitely has its place, but for those with mental health issues or endometriosis, it's much more beneficial to practice a restorative yoga. So very similar to the one shown in the bottom photo, which is going to calm the body and the mind and reduce arousal hormones like cortisol and adrenaline. So this is just a really beautiful quote from Iyengar, which I believe encapsulates what yoga is about. So yoga teaches us to cure what need not be endured and endure what cannot be cured. So there's lots of benefits to a yoga practice and a growing body of research to back these up. But some of what I would consider to be the most important to mental health and endo are the following. So nervous system health and regulation. So the physical postures accompanied by deep breathing and active relaxation affect the nervous system, which in turn affects the endocrine system. So there's a balancing effect on hormones. And this is really important for those with endo because stress hormones like cortisol, if prolonged, begin to use up healthy fats in the body. And if there's not an adequate supply, then they'll begin to steal from other hormones such as progesterone. So if progesterone is low, estrogen will be higher because they seesaw with each other. And estrogen, of course, promotes the growth of endo. So resilience. Now, there's obviously going to be a strengthening of the body for a regular yoga practice, but mental resilience is our ability to recover from or adjust to misfortune, stress, change in our lives. So what yoga does brilliantly is put the body under a small amount of stress or what might be considered a challenging posture, and then asks you to relax into the challenge through using your breath. This starts to rewire the brain and the way it responds to challenge. So I've seen again and again students blown away by what they find themselves facing or achieving, even when not in a class setting. So yoga practice really gives us the skills that you can take off of the mat. Body awareness. So again, by focusing into the body, we can begin to actively turn down these alert responses. And by encouraging a non-judgmental relationship with the body, we can more easily pick up on the cues that it's sending us, taking a rest when we need, forming healthier habits. Very often after trauma, there's a detachment from the body. So there's some really gentle practices to bring that sense of connection to the body back. Mindfulness. So connecting to the body is a form of mindfulness in itself, but the whole practice brings awareness into the here and now. So many mental health issues have our mind focused on the past or worrying about the future. And being focused on this moment is a skill we can build just like any other with conscious effort. And it's a main focus within yoga. Excuse me. So cool fact, yoga practice increases levels of gamma aminobutyric acid in the brain, which is a chemical that regulates nerve activity. So this has been found to be low in those with anxiety disorders. But with a yoga practice, we can stimulate this chemical that mimics anti-anxiety medications naturally. And connecting to the breath is going to stimulate the parasympathetic nervous system, which I'll explain later. So I've mentioned the breath a couple of times, and within yoga, breath work is called pranayama. So here are two examples of breath patterns which have different effects on the body and mind. So both are completely safe for beginners. So we have box breath, also known as equal breathing. So this has a balancing effect on the body. It turns off stress hormones and promotes calmness, yet at the same time will help you focus. You want to come to a comfortable seated position for breath work, keeping the spine nice and elongated, drawing the shoulders slightly back, opening the chest, keeping the chin parallel to the floor. Take a couple of slightly deeper breaths and then breathe in through the nose for a count of 4. Hold the breath for a count of 4. Exhale for a count of 4. Hold the breath out for a count of 4, then repeat. So 4 rounds of this breath will take you around 2 minutes and you'll feel noticeably different afterwards. So it's a great, simple, quick practice that you can do to balance out how you're feeling. So 4-7-8 breathing is slightly trickier, so it may need some practice, but has a much more profound effect on calming the nervous system because of its focus on the extended out breath, which brings heart rate down, lets the body know it's safe and it can rest and restore itself. So again, taking that upright posture, sitting against a wall can help if that's tricky for you. Then inhaling through the nose for 4, holding for a count of 7, then exhaling for a count of 8. So you don't want to start with more than 2 or 3 rounds of this, probably best before bed, and it's really great for insomnia. So a little bit about the autonomic nervous system, which is basically takes care of all the processes and functions in the body that you don't have to think about. So heart rate, respiration, blood pressure, digestion, amongst others. It has 2 branches. When one's activated, the other isn't. So the sympathetic nervous system deals with what's often termed our fight or flight responses. So these are very vital responses that happen in our body so that we can respond quickly to threats to our survival. Sorry, I lost my trail of thought there. But our body doesn't recognise the difference between physical threat and threats to us emotionally. So that upcoming surgery, that stressful meeting, feeling rushed, anxieties around diagnosis and what that may mean to our lives, they can all activate this system. Most importantly, the body is meant to only spend short periods of time in this activation. The body sends resources to the muscles away from functions that are not vital for survival in that moment. So this is why digestive issues are frequent in those who have chronic stress. And this really relates to what Jodie was saying about the cycle of stress and pain leading to more stress and pain. And we need to find ways to get out of this cycle and to help the body restore itself. So when we practice yoga and manipulating the breath, we're actively switching to our parasympathetic nervous system. So the body feels safe, we can divert resources back to rejuvenation, digestion, and all the functions that help us feel well. Brain activity calms and we feel noticeably calmer, more focused, and we can even become more social. So our breath really is the way to hack our nervous system, if you like, because it's the one process that can happen automatically. And we also have the ability to consciously change our breath pattern. So I hope it's starting to become clear how much influence we can have over these processes that can really make a difference to pain and stress levels, our hormone secretions, and have a big impact on how we feel. So research has shown just 3 minutes a day, just 3 minutes, which is really manageable, have a measurable impact on perceived stress. Okay, Yoga Nidra, which is another powerful practice for stimulating the parasympathetic nervous system. A version of Yoga Nidra is having some really great results in studies around the world on veterans with PTSD. So again, coming home to the body in a safe environment is allowing people to deal with trauma. So Yoga Nidra, otherwise known as yogic sleep, is a type of meditation that invites you to consciously relax the whole body whilst laid comfortably on the back. So you're encouraged to stay awake through the whole process. We're so used to falling asleep in these deep levels of relaxation, but by staying awake, we can start to train the body and the mind to feel relaxed while we're awake. It's very often my students' favourite part of a yoga class, and I always include it because of the benefits. So practices can last 5 to 90 minutes, and it's great for those who may have tried meditation and felt it was difficult, which it very often is. Because you're guided through the practice, you just listen and no effort's required at all. So a good sign that the parasympathetic nervous system has been activated is the body cooling down quite rapidly. It does this as it draws energy back away from back into the organs and away from the extremities. So comfy, warm clothing and blankets is always recommended. So the benefits of Yoga Nidra, that body awareness and connection, so noticing what's happening, where the tension is there gripping, and tuning into our needs. Makes you more aware of emotional and bodily shifts. So you're going to become more attuned to shifts in your emotional states, which will allow you to notice your needs before they turn into overwhelming mountains. Nervous system benefits, as we discussed, building the capacity to be relaxed whilst awake. So learning the difference between a calm body and a tense one. So you might notice that tension creeping into your shoulders that causes headaches, and you can then you can just take a couple of minutes to relax them again. So it's been a joy talking to you about yoga and explaining how it helps with mental health and endo. And I hope this has given you a few practical tools that you can use, and I wish you all the best for the future. So thank you, and I'll hand back to Beth.
Oh, that was if you unmute yourself. So thank you, Crystal. If anyone has any questions you'd like any of us to answer, please just pop them in the chat box and we will do our best to answer them as best we can. So me and Emily have a couple that we were asked from our team group and from our Facebook page. So the first question, which I'm going to do my best to answer, was why do I feel mentally worse now I know what the issues are and about my op? Feel very sad at the moment. First of all, I'm sorry you're going through a hard time and that you're feeling quite sad. Receiving a diagnosis of endometriosis is really difficult, and I think that can be quite difficult for us to get our heads around because a lot of us spend a lot of years trying to get a diagnosis. So of course, having a diagnosis can be a good thing in some ways, but that doesn't take away from the fact that it's difficult to process the fact that you have an illness that currently doesn't have a cure. So it's completely understandable to feel upset by that when you've recently received a diagnosis, and even if the diagnosis wasn't recent, it's completely valid if that affects you. And I think it's also really important to talk about how a lot of us, when we, obviously I don't know what your situation is personally, but when we kind of have that realization that we might not ever get our old life or old self back, we have to kind of grieve for that, because it's something we had and now we don't have it anymore, and we might not necessarily get it back. Maybe we will, but there can be a lot of uncertainty. So it's okay to give yourself some time to definitely digest that, because it's really difficult. And you will find things that help you, I'm sure. It can be a lot of trial and error, which is frustrating in itself. But also, as I mentioned earlier, which I really hope is helpful, having an operation can affect your mental health. So if you are struggling, please don't hesitate to get in touch with your GP or the people who did your operation, because they can help you. They will be able to hopefully refer you to someone who will be able to give you the right support, because this is something a lot of people struggle with. So you're not alone at all. We're all sending you lots of love and hoping things improve for you soon, but please don't hesitate to get in touch if you think there's anything we could do to help. Of course, we would always love to help in any way we can, and I really hope the webinar has been helpful somehow. So yeah, I hope that somewhat answered your question, and just know that it's understandable to feel worse right now, but I'm sure that won't last forever. So now I'm going to pass back over to Emily, who is going to answer a question as well.
Would help if I unmuted myself. So we were asked, what do we think when people say adolescents can't be depressed? I think that it is quite obvious that that just isn't the truth. I'd probably even go as far as saying that people that think that and hold that belief are quite narrow-minded. I am somebody that was diagnosed with depression when I was quite young. I think I was 14 or 15. I was battling with doctors around that time to get diagnosed and things. So yes, it is very real. And that statement is just completely untrue. I think things like that do really invalidate my experiences and other people's experiences. So yeah, just not right. There are a few questions in the chat if anybody would like to answer those. If not, I'll hand back over to Beth.
I'm happy to pick up the one about community mental health. I think the problem with community mental health is what they might try and do is refer you to a chronic pain team or part of the long-term condition services to manage that part of your condition. But typically they should try and support you to create a care plan to manage those two things independently. So it's looking at the impact that this is having on your mental health for you, but then also thinking about what can we do to kind of systemically support you with the social impact, the kind of the psychological impact that the endometriosis is having. You can normally stay open to mental health services if you're also open to long-term condition services. I'm not sure where you live, Rachel, but in Portsmouth, we've got 2 chronic pain services. We have one in the hospital that's more to do with just physical pain. And we've got one in St. Mary's Hospital, which is more around the psychological impact. So with regards to the support worker, they should be kind of working alongside you and being complementary. And I think the thing that actually needs to be taken into consideration with endometriosis is looking at kind of the disabling impact it does have on people, and that there needs to be adjustments and allowances made for you in order to be able to attend appointments, to recognise there might be days where you can't go out or function the way that you would like to. So I think if you can get hold of a psychologist as such to help support you with that, I think that would be fabulous. But yeah, I forgot to say, I really wish you well with that. And if there's anything at all that I can do, you're more than welcome to email me. My email's on the bottom of the presentation. But I'm sending you love.
Thank you, Sadie. Another question that we had from our teen group was, why do you think there is such a stigma between endo and mental health? I think that there's a lot of reasons for this. There's definitely a huge stigma, which a lot of people are working very hard to break down, which is fantastic. And a lot of progress has definitely been made, but there's certainly still progress to be made, which we are, of course, working on. So one of the things I think contributes a lot to the stigma is the fact that the majority of young people who menstruate are told, your periods will be painful, you suffer, you get on with it, there's nothing wrong with you, you can't handle pain, and so on and so on. But actually, having debilitatingly painful periods is a symptom of there being a problem, whether that problem is endo or something else. And that's something that a lot of us, in my experience anyway, don't realise until we get to maybe 17, 18 or even older, because it's not really spoken about. And periods are obviously still ridiculously seen as a very taboo subject. People don't like to talk about it. So then when we combine that with mental health, which is also still sadly in a lot of places deemed a taboo subject, which we should kind of scoot around and sugarcoat, when we put the two together, the stigma almost just gets even larger, especially when within the region of periods or mental health there are abnormalities. People just don't seem to like to talk about it because society over the years has drummed it into us that it's bad or it's wrong or it makes people uncomfortable. And maybe sometimes talking about it does make people uncomfortable, but it's also an incredibly uncomfortable thing to live with. So if someone has to live with it every day of their life, I'm sure other people can stand to listen to it for 5 minutes. That's the way I try to look at it anyway. So I think that's just a couple of the reasons why there's stigma. Obviously, it's a very long running thing, very complex, but that would be my input there. There's a question in the chat about endometriosis and menopause. Does anyone want to take that? If anyone is particularly knowledgeable in that area.
I did message her back and just said that she can get in touch with me because it is such a massive area. I did a talk not long ago with someone from Perimenopause, a group set up for women in perimenopause. We did a big thing on menopause. It's one of them things that I've researched a lot because I'm in the menopause myself due to having a hysterectomy. So it's something that I've done a lot of research on because I can, really. So yeah, we will have a chat off of here because it's just a massive, massive area.
Yeah, of course. Thank you so much. That's amazing. I think Emily has a final question from our team group.
Yes. So somebody in our team group asked, what do I find helps most when I'm having a bad pain day, both physically and mentally? Physically, for me, I just need to get lots of rest, painkillers, a hot water bottle, a heat pad. It's all about finding what works best for you and what you're most comfortable with. Mentally, I just do my best to stay grounded. It's so easy to catastrophize and spiral. So I just try and keep myself as calm as possible. I like to think of pain and the feelings that you experience when you're in pain like waves on the sea. They come and they go. Some are big, some are small. Sometimes the sea is really calm and sometimes the sea is really rough, but you always get through it in the end. So that's how I like to think of it.
Well, thank you so much. Unless there's any other questions.
There's just one more from Beth. Sadie, is there any way she can refer to Talking Change, even though she's not in the catchment area?
So Fabulous Chantel used to work in iTalk and then she's joined us at Talking Change, and I think she's responded with exactly what I would say. But if you don't feel listened to by the therapist that you had, you can request another therapist. And it sounds like from what you said that you had quite a difficult experience. So I think it's really important to feed that back and ask to see someone else, because there's so many different therapists, and it's really important you get the support and care you need. So thank you to Chantal for answering that.
Well, thank you for all your questions. Thank all of you. So, there's another question. Do you have to go on, Sadie? That's probably one for you.
No, that's fine. Typically, if you want to go to a chronic pain clinic, you will need a GP referral. So just go for an assessment and they can write a letter to support it. You're welcome.
Well, thank you everyone for your questions and for joining. I hope that this has been helpful, and although of course it's been going, I hope it's been enjoyable where it can be. Of course, don't hesitate to get in touch with any of us anytime, our organisations, if there's anything we can do for you. Of course, that's what we're here for. A huge thank you to, of course, everyone, especially Jodie, Sadie and Crystal from Endometriosis South Coast for being so wonderful and joining us. Thank you to the rest of our team at Endosupport United, who are always absolutely amazing. Yeah, thank you all so much. Does anyone have anything they want to add before we finish?
Thank you for having us.
Yeah, it's been lovely. May your wounds be healthy.